How's it going? It's Dr. Greg Marion here at One Spine Chiropractic. Today we're going to be discussing scoliosis, what types of scoliosis there are, but also what we do in our office to help treat scoliosis. So more importantly, there are three types of scoliosis. These are idiopathic, not knowing where that curvature came from. Congenital, you got it passed down from one of your family members, mom typically. It runs in females a little bit more, but also it might be neuromuscular. You might have a condition that's causing this issue. So what we're going to do here in our office is do a thorough family history to see exactly where your curvature might be coming from and what's causing that scoliosis. So what scoliosis is, first of all, is an abnormal curvature in your spine. Typically, they tend to have them in that thoracic spine. Sometimes you may have a curvature in that lumbar spine, which is your lower back. A lot of times when you have a curvature in that lower back, your pelvis tends to drop and have some issues. So we're going to evaluate for that whole thing in our office. And from the side, though, you do want a few curvatures. You want a nice lordotic curve, you want a kyphotic curve, other lordotic curve. But what we see here in our office is a lot of kids with scoliosis. And the reason we like to see a lot of kids that have scoliosis here in the office, because it's easier to treat them. The sooner we catch a problem, the sooner and easier it is to fix it. So a lot of times with kids, ages 3 to 5, we may notice some curvatures, a shoulder that's higher, have abnormal posture. So what we want to do is begin treatment there. Because if we wait till they're older and the growth plates have finished growing, we tend to have tougher times and it's a little harder to correct it where we need to. Like we talked about, a lot of our females that we see in here, typically they get noticed in school in the age of 12 to 13 and stop getting worse with the curvature about the age of 17 or 18. So if we could get a curvature in here early, it's a lot easier for us to correct it and maintain that throughout life, because we don't want to let that go and let that go. And unfortunately, that curvature gets worse. And as they're adults and older adults, it begins a degenerative disease. And what happens with degenerative scoliosis, that curvature gets worse with time, tends to compress the disc and the nerves, causing pressure and pain, maybe have some sciatic pain, some abnormal range of motion, but more importantly, scoliosis also may affect how healthy you are, because we didn't know that, but your brain controls all of your organs, and your brain controls all those organs via the nervous system, which is your spinal cord, and these nerve roots that get exit up through there. So what you might feel as a patient is lower back pain, but also a symptom you might be having some digestive issues, some reproductive issues. And that's why it's really important to get in here early to evaluate that and make sure that the brain, the nervous system, everything's functioning the way we need to. So what we do in our office is, first of all, with kids, is do a corrective and thorough chiropractic examination. We want to evaluate what's going on with that chiropractic examination. If we do see there is some positive signs, we'll go get some x-rays done. More importantly, we want to get those x-rays evaluated and get some numbers on them with a Cobb angle to see exactly how far that curvature is. Once we determine that, we'll be able to determine if we could help you out here in the office, send you off to an orthopedist, or hopefully we won't have to go to the extent of doing any surgery, because anything over 40 degrees that is typically a surgical consult. What the doctor wants to do is, unfortunately with a curvature, put rods up and down your spine and brace them together. So at any point we could get that, evaluate it early and prevent that from happening, the better off you'll be, because success rate of rod surgery, it'll help their spine from getting any worse, but more importantly, what do you think living with your spine fused for the next 40, 50 years is going to do? It's not going to feel very good, have some limitations. So anything that might be giving some trouble in your spine, any symptoms or posture abnormalities you think you or your little one may have, send them into our office. We're very thorough here. We treat this condition regularly, and we're more than happy to help. So give our office a call or visit onespine.com. Thank you.